Over 230 babies have been born with HIV in Gauteng in the first 6 months of the year, despite the fact that drugs to stop the mother-to-child transmission of HIV have been available for the past 25 years. 40 of those children were born in the Tshwane district. And South Africa has one of the most remarkable public health successes of the last decade in Southern Africa, which has been the reduction in the number of babies born with HIV. This was achieved through the provision of antiretroviral therapy to pregnant and breastfeeding women living with HIV. However, a recent report shows that this has decreased, with at least 30% of pregnant women in South Africa having HIV and their infants exposed to both HIV and antiretroviral drugs during pregnancy and breastfeeding. And to unpack this, I am joined by TAC Gauteng provincial chairperson, Monwabisi Sidwell Mbasa. Good morning. Glad to have you join me on the news.
Morning, ma'am, and I would like to extend my greetings to your viewers as well.
All right, let's kick off. What are the most common factors contributing to the high rate of mother-to-child transmission of HIV, particularly in Gauteng?
Are multi-layered, and I will try very quickly to unpack that for you. One are issues to gender-based violence. Those are social issues whereby a woman will be pregnant and the boyfriend or the father or the husband would want to force himself onto the woman, and you find that has been having multiple partners. And that creates a problem during that particular period, is what gets us to where we are. Secondly, within the system now, you find that, in other healthcare facilities, there are shortages of staff, long waiting times. Therefore, women, they tend not to go to the clinics, and they decide now not to actually make, those consistent visits to the clinics. And related to that is that at times they meet, very where they would be given or subjected to bad staff attitude. So those are the issues those are the factors that we have identified. And with respect to this issue that we have now, as activists, we'll need to actually do our campaign to ensure that at least women, especially those who are pregnant, are being actually subjected to a much more, I would say, human and dignified, process of accessing services.
It's interesting you touched on those exposed to these as women, who undergo gender-based violence. You also talked about those who present themselves late, in the hospitals. How about other demographics? Which other demographics of mothers are at risk, of transmitting HIV to their children? I'm looking at it from a point of view of, is it the younger population or the older population?
It is the younger population, young people between the ages of 15 to 24, even older, around to middle age, if you like. And then you also have within that, we've got people whom we call key and vulnerable populations, which mean they could be sex workers or former sex workers, and also people of transgender as well. They are subjected to mistreatment at times and be stigmatized at times. So those are people who will all, from time to time, will actually have that lethargy of not wanting to present themselves in the healthcare facilities, and because of such social issues that actually prevents them to be able to visit clinics, much more consistently.
I'm tempted to ask you what reforms or measures are being made to help stem the tide of this transmission from mother to child. What efforts are being made whatsoever to orientate or sensitize people to prevent a prevalence of this issue?
The first thing that needs to happen, of which has been done for quite some time, is that it's awareness around HIV. Two, there's this concerted effort that needs to be done, of which it has been done. It has been doing. It's something that has been done for quite some time. I will just give you a very simple scenario. Around 2001, pregnant women were given Naverapine through the organization that I'm leading, which took government to court to force government and ensure that they procure ARVs and Naverapin to give to pregnant women to try and arrest this thing of mother-to-child transmission. And these are some of the things that needs to be done now to ensure that at least all pregnant women in the beginning of their pregnancy period, at least they must be rolled out on pre-exposure prophylaxis in case if during the pregnancy, even post-pregnancy, when they have to engage in the bedroom activities, at least we should be guaranteed that those women, those mothers are on treatment which prevents them from one, contracting HIV so that it cannot be transmitted to the unborn child, and also to ensure that those who are already HIV positive are actually put on treatment on ARVs to ensure that their viral load is that cannot be transmissible to the unborn child as well. So those are the measures that needs to be done. That means they require civil society in the form of ourselves to ensure that government prioritize that particular approach.
Indeed, we hope all of these measures are adhered to so we can have a safe environment, for mother and child. Thank you so much for your perspective on the news. Monwabisi Sidwell, many thanks for your insights.
Thank you so kindly. It's a pleasure for this opportunity. We appreciate it.